The trigger warning for this video is for those who may become triggered by truth or triggered by things that we might see or hear in the media or on TV. But you should listen anyway for the safety and health of you and your family. So in the news, as of late, there's a lot of emotion and a lot of dissension amongst people about some of the claims, I guess, that have been made by people like RFK Jr. and his colleagues when it comes to things like autism, vaccines, Tylenol use, acetaminophen in pregnancy, and the complications or things that it could lead to. But here's the deal, y'all. This is not new. This isn't fringe. It's not conspiracy theories so that so many people are getting sucked into believing. So let's actually look at the science, actually look at the studies that have been done. Various studies exist that are going to be on this video that includes a meta-analysis from all the way back in 2014, which looked at 16 different studies, and it was done. One of the authors of this was a dean of a Harvard medical program, amongst many other institutions, that have shown an increased acetaminophen use during pregnancy has been linked to neurodevelopmental issues, which would include things like autism, but other things as well, other spectrum disorder issues, other things like asthma, ADHD, attention and executive function issues, right? So brain issues, communication struggles, behavior challenges, psychomotor development, and the list can go on. Another study that was done more recently in 2022, which was a systematic review of 30 other studies. So a systematic review is looking at all of these studies that have been done on this topic, and they're finding the same exact thing. The authors in this comprehensive review, I mean, guess what they found, right? And if you know, you know. That's right. It's fairly obvious that the vast majority of these papers and these studies that have been published on this topic have shown that acetaminophen use during pregnancy does in fact increase the risk of neurodevelopmental struggles or issues. And again, that can range from ADHD to sensory processing issues to autism. Of course, logically, how often someone uses, the dosage, and how long of a time frame they use for all plays a role. But come on, like, why are we saying these are safe and effective things when the science actually shows otherwise, right? So, are you truly following the science, or are you getting sucked in and being swayed by in your thoughts by the biases that you're hearing and reading about in the media or from politicians that could potentially be bought and paid for, right? Are you truly listening to your mama or papa gut? Are you following the science, or are you trusting blindly the professionals that say it's safe and effective, right? Are you questioning things for the safety of yourself and of your kiddos? I mean, that's what I would encourage all of you to do, right? And unfortunately, that's what we need to do in this modern medical system that we're all in. And although medications, I always will say, can be life-saving, life-changing, and necessary, are they really as safe and effective as what they're telling us they are? And that can go for a whole slew of things that are put out there, right? So I teach my patients every day about the complications and the effects, the cascade effects, things like statin medications, things like the weight loss drugs, things like, I'm gonna just say vaccines, because it is true, it's part of the story, y'all. So I don't think what we can do is become complacent in putting all of our faith and trust in something that may not be as trustworthy as we once thought, or you may have once thought. So that's my encouragement for y'all today. Okay? Know the truth, know the science, know what's actually out there. Talk to people who may have differing viewpoints. In functional medicine, I tell you, Tylenol, specifically, since that's what I'm talking about, right? It's a fever reducer. People use it for pain. People use it for discomfort. But functional medicine will actually help you use natural things that are just as effective, that don't have those complications or risk factors associated with them, right? So when are we going to start opening our eyes? When are you going to start opening your eyes to the truth and the reality of what's going on? Right? So an encouragement to you today, and I just wanted to get some of these things straight, because it's just so much dissension and just people that are polarized by these kind of topics. But again, take a neutral approach, right? Find out for yourself. And this post, this video, share it, because people need to hear this. There's evidence, y'all. This is, again, not conspiracy. There is evidence. And you'll see, as you saw the screenshots that I put on, this is PubMed searches. This is National Institute of Health searches. These are high quality journals that are studying these things and doing these systematic reviews, okay? So don't just let things pass by as the normal, right? Because are they really needed? Are they really necessary? Are they causing issues that maybe once we didn't think they were? All right. That's all for today. If you have questions, just drop me a DM, Facebook, Instagram, email me, get a hold of me through my website. Any way that you want to talk, I'd love to help you all out. All right. Bye-bye.